Hi, this is Divya Prakash from Nuclear Medicine Solutions. I am a nuclear medicine physicist and radiation safety officer by profession, but got an opportunity to work as quality coordinator in a nuclear medicine diagnostic center, which was in the process of NABH accreditation and conducted pre-assessment as quality manager. Then worked in a JCI accredited hospital and was quality in charge of nuclear medicine department, which was working in tandem with quality department of hospital. From there, joined a new setup of nuclear medicine and molecular imaging, and there, with support of my fellow colleagues, could achieve NABH accreditation without any NABH consultant, and now going through surveillance audit. Being an expert professionals, we know how to provide quality services, but generally not much aware about quality documentations, standard operating procedures, and how to quantify quality parameters. This is a very vast subject altogether. So, thought to share my experience so that everyone like me have not to rely much on consultants and make our own documents and set up processes and procedures as per accrediting bodies standards. But whenever we go to start the preparations for these accreditations, there are a number of questions come in our mind, like which all infra related needs are required to be fulfilled before going for these accreditations, which all policies and SOPs are to be made, and what are the contents are to be there for those policies and SOPs, and how to quantify quality. Being professionals, we know the quality of images, we know quantification of images, but we do not know how to quantify the quality and which all the documents are required to be made for these quality indicators. So in this set of presentations, we are going to see the answer of all these questions. So this whole process we have divided in 4 parts, and the first part is quality in healthcare. In the second part of this video series, we will be learning about accrediting organizations and their standards, and according to their standards, what are their structural, procedurals and outcome related needs, that we will learn in third video. In the fourth video, we will learn about how to set up quality indicators. So let's begin and see what is quality in healthcare. There are a number of definitions available on internet about the quality, but for me, in healthcare, quality means achieving trust. How can we achieve trust? This is by providing care and cure, which is safe, effective, timely, efficient, equitable, and people-centered. When I say like this, what is the meaning of safe? Safe means minimizing risk and harm, including preventable injuries and reducing medical errors. When we say effective, our services should be based on scientific knowledge, and it should be evidence-based. It should be on time. When we say efficient, it should be maximizing resource use and avoids waste. It should be equitable, which does not differ according to personal characteristics such as gender, race, ethnicity, geographical locations or socio-economic conditions. And it should be people-centered, means providing care with preferences and aspirations of individuals. So, what are quality building blocks? There should be availability of beds, OPDs, staff, building, space, equipments, supplies, resources, and basic monitoring of patients. If we see, these all are structural needs of any hospital or any diagnostic center. During this corona pandemic, most of the governments across the world had to put lockdown because of These all the basic needs were not available in such a mass quantity, and that gave the time to the government so that they can increase their capabilities. If we have these all the things, then we need to have protocols, procedures, policies, training, efficiency, low waste, and appropriate use of resources. These all are procedural needs or process related needs. And then finally the outcome comes with patient and staff satisfaction, with low infection rates and good clinical outcomes. So the three things: first is structure we need, then we need the processes, and then finally it is outcome related needs. In any accreditation, these all the three things are audited, checked, and seen. So what is the need of quality? There is a rising consumer expectations. There is a huge competition in the market. As per regulatory body guidelines, if you're not having accreditation, insurance panels or TPAs will not be able to impanel with us. There is a Consumer Protection Acts. There are regulations which say that certain quality we need to provide. And the various government impanelments like CGHS, ECHS, ESI, they can be taken or they can be given only based on certain accreditations which they need or which they ask. So what are the benefits of accreditation? It improves level of community confidence and trust on our brand, on our name. It provides a roadmap for standardization which provides safety and quality. It is a system-oriented approach and patient-centered culture is developed if you are accredited. It improves patient satisfaction level. It improves health outcomes, provides external recognitions and enhanced reputation. In the second part of video, we are going to learn about accrediting organizations and their standards, which we will see in the next video. See you till then. Thank you very much. Please feel free to write us at support@nuclearmedicinessolutions.in for any feedback and query. Thank you very much.